All right, this is going to be my presentation on thalassemia. Here's the contents we'll be going over and some background. So thalassemia is a somewhat common monogenic inherited blood disorder where the body does not produce enough hemoglobin, or in particular the alpha or beta proteins in hemoglobin, so less full hemoglobin will be present. Hemoglobin is very important to red blood cells, and it allows them to carry oxygen efficiently to different parts of the body. A lack of hemoglobin means a lack of oxygen to certain tissues and can cause serious problems like anemia. Uh, a person with thalassemia can have a very minor case of anemia or a very severe case that causes damage to organs and can potentially lead to death. There are two types of thalassemia. You're going to see thalassemia minor and thalassemia major. Thalassemia minor is the alpha protein version, as where thalassemia major is going to have issues with that beta protein. I'm going to refer to thalassemia minor a lot. It is not as medically intensive, and thankfully that is what I live with on a daily basis. It is what my family lives with. We all actually suffer from thalassemia minor. However, I will be mentioning major and how they are different and how it changes that lifestyle. As for the anatomy, the main systems affected by thalassemia are going to be your circulatory and respiratory systems. Your red blood cells will be malformed and not as functional due to that lack of hemoglobin, or in particular the proteins shown in the diagram. And it will not be as effective, and there will be a larger demand for blood to get the same amount of oxygen. Also, due to many blood transfusions that occur in poor erythropoiesis, there can actually be an iron buildup in the blood that can cause problems down the line in thalassemia major patients, and it can cause heart issues. The respiratory system is also going to be affected due to red blood cells having that low oxygen carrying capacity. It needs to adjust. I've experienced this my whole life. It needs to adjust to getting that oxygen into those blood cells, and you feel out of breath very quickly. Two other systems that are affected by thalassemia are going to be your lymphatic and your skeletal system. Your spleen is going to be working on overdrive, and it will become enlarged your entire life in order to help make more red blood cells, because the malformed ones have such a short lifespan. And then as for the skeletal system, same deal. That increased need for blood means more red bone marrow. More red bone marrow means more empty spaces in those bones, which for longer bones, it's okay, but it will make them more brittle and susceptible to breaking. So for the physiology, people with thalassemia minor will have a hemoglobin level of around 7 to 10 grams per deciliter. I was unable to find major because they have such issues that they constantly have to have blood transfusions. And then the normal level is around 13 to 17 grams per deciliter. This shows that the oxygen levels in thalassemia in people with thalassemia is going to be significantly lower, and the red blood cells tend to die off quicker. So they need to be replaced much more often than in a normal person. The feedback loop for thalassemia, it's going to be genetic. It's a genetic disorder with that reduced production of alpha or beta proteins in hemoglobin. But its effects actually have another feedback loop in the body, and that is going to be due to anemia. The anemic feedback will lead to the expansion of erythroid progenitors, such as that enlarged spleen, that red bone marrow. In thalassemia major, this oxygen shortage can lead to extreme issues that will require blood transfusions constantly, as I was saying, in order to keep things under control. In a normal person, your body's going to be able to keep up with that. So for pathophysiology, there's nothing necessarily wrong with the physiology for thalassemia. It's a single gene disorder. Lots of carriers, lots of people have minor, not as many people have major, and your body just doesn't produce those proteins. And so here's some symptoms and their cause. That fatigue and weakness is going to come from a lack of oxygen to the muscles and organs, an inability to catch your breath, and asthma, kind of similar to fatigue, but I wanted to throw it in because, especially with sports, when you're doing something exhaustive, you're not going to feel like you can catch your breath. That's going to be also due to that lack of oxygen supply. Facial bone deformities, it's going to be from your expanded bone marrow. As I was saying, in the long bones, it's not going to be as much of an issue. In your flat bones, you're going to see some deformity. Abdominal swelling is going to be due to that swollen spleen. Slowed growth will be due to the anemia. So again, less blood, less oxygen to different parts of the body. And then heart problems. Congestive heart failure may be present in severe cases of thalassemia major due to an iron buildup in the heart. As I was saying, due to those transfusions, due to that poor erythropoiesis, you can run into issues there. Homeostasis is going to be thrown off in the body due to that lack of oxygen. Your body does adjust to combat it. However, in thalassemia major, you are going to see due to those transfusions. So obviously your body can't maintain homeostasis on its own. As for diagnosis, super simple. Blood test. Do a blood test. Your doctor can come back and let you know if you are suffering from thalassemia minor. Hopefully you already would know if you have major, but they can tell you. And then a blood test will provide DNA that can confirm the gene for thalassemia. You can see if you're a carrier. Treatment, however, it's going to be a little different, not as simple. Thalassemia minor, it's more of an inconvenience. Sucks if you want to be an athlete. It's really hard to live with sometimes because you just feel out of breath. However, for thalassemia major is where it gets a lot tougher. Treatment means regular blood transfusions, so your organs, your muscles can have that oxygen-rich blood and really keep living. However, according to the National Heart, Lung, and Blood Institute, if it is caught early and it is available, you can get a stem cell transplant for your bone marrow, and it is the only known cure for thalassemia, only offered to thalassemia major patients. AI use, you will see here that the International Journal of Advanced Research in Computers and Communication Engineering's long name is currently says that the only AI in use is a predictive AI that is predicting the chances of a child being born with thalassemia, in particular thalassemia major. Thalassemia minor, not such a big deal. However, for thalassemia major, they would like to know in advance so that they can have that blood ready. You need to have certain things in place so that you can support that baby. And that way it is saving lives through that predicting. For demographics, a lot of people refer to it as Mediterranean blood. Actually, thalassemia beta is typically more common around the Mediterranean, whereas thalassemia alpha, or your minor, is going to be more of that Southeast Asia, that Middle East, and your South Asia. However, those are the main areas affected. We can see on this map the areas that are more cluttered. However, it is worldwide. It's going to affect everywhere. People carrying the thalassemia trait or have thalassemia minor are going to have normal life expectancies. You can live like normal. There's about more than 300 million people in the world that carry the trait. However, there's only going to be about 1 million people who suffer from thalassemia minor or non-transfusion dependent thalassemia major. About 100,000 people around the world do suffer from that transfusion dependent thalassemia major. Of that 100,000, there's going to be about 1,200 cases in the United States per the Boston Children's Hospital. According to the National Library of Medicine, in thalassemia major patients, the cumulative survival rate from birth to 10 years old is about 99%. So very, very solid at a young age. However, skipping ahead, by 55 years old, it's about 51%, showing that there is actually a very high mortality rate as you get older and you have a very short lifespan. And then according to American family physicians, so focus more on the US, you're going to see a life expectancy of thalassemia major patients be about 17 years. And most of them will die by 30 due to complications of the heart due to that iron buildup I was talking about earlier. So very, very short lifespan, unfortunately. And that is just my sources. Thank you.